Hello, this is Lockdown TV from Unheard. So masks, face masks, these little pieces of cloth that none of us had thought very much about until this strange year, now seem to be a point of maximum controversy. There are people who are very strongly in favour of them, very strongly against them. Well, one question that seems quite hard to get to the bottom of is, do they actually work? And one of the reasons for that is there aren't that many studies with proper evidence either way. So we have a new study out today done by Professor Henning Bundgaard and his colleagues at the University of Copenhagen. And he joins us to tell us about it. Hi, Professor.
Hi, how are you today?
Very good, thank you. So first of all, just tell us about your study. You selected a group of people and you did a control sample between two halves. And what did you find?
Yes, we tested if face masks would reduce the rate of infection by 50%. That is when a healthy person wears the mask, on top of what we are otherwise recommended to do. That is mainly to keep the social distance and take care of hand hygiene. Such a great reduction in infection rate wasn't seen in our study. However, there was a minor change between efficacy between the two groups. That is a reduction of 15 to 20% in those who were wearing a mask. However, when this is the magnitude of the effect, then the uncertainty is quite high of the number. That is, it might be up to 46% protection, but it may actually also be that you don't have any effect of the mask. But on balance, if we are looking at it, it seems we have a small degree of protection of masks. That is the conclusion from our study.
So give us the actual numbers then. There were 6,000 roughly people in the study, so 3,000 people wearing a mask, 3,000 people not. And how many of them got infected?
Roughly 2,500 in each group finalized the study. And in the group not wearing masks, 53 got infected. And in those who were wearing a mask, 42 got infected. That is, the difference was 11 persons. And if you say that number in a different way, then it would mean that 300 people should wear a mask for roughly a month in order to protect one from getting an infection. And you could say that is a small number, but a small number is probably also worth considering because we are dealing with a potentially life-threatening disease.
I guess it would have been almost preferable to do the study when there was more of the disease about. I mean, I guess in Denmark there's more of it about than there was when you did it. Is that right?
Yes, that is right. But actually, in our design of the study, we anticipated that 2% would be infected during that period of time. That was based on the National Board of Health calculations or estimates. And we reached 2.1% infection in those not wearing masks. So we were actually spot on in that sense. So we are quite happy that we reached that. And you can't compare the official infection rate numbers because they are based on swab test with PCR. And we did antibody testing and PCR. That is, we would catch all infections. You could be in our study being healthy, then 1 week later you would be infected. You were diseased for a week or two, and then you were off, and we would test negative. But using antibodies, we would count these people in as well. So for that reason, you can't just compare the two numbers from the official Danish numbers in our study.
I see, because I was going to ask, since the publication, it's been criticized, I guess predictably in a way, it being such a controversial topic. And I wanted to raise some of those technical objections that people have made to see what you had to say. And one of them was indeed that most of the test results came from antibody tests as opposed to PCR tests. So you're saying you think that's a preferable way of doing it?
Most certainly. We would have missed out big time if we hadn't done it that way.
So another critique that has been talked about is that the self-reporting does not necessarily equate with wearing a mask. Just because they told you that they've been wearing their mask, maybe they haven't. What's your response to that?
Where I'm from, and I'm a cardiologist, and you could ask, what is a cardiologist doing in this mask study? We are used to do drug trials, and doing drug trials, we ask the patients, do you take the drugs? And we are also counting the pills, but of course the patients know that we are counting the pills. So a lot of research is actually based on trust to patients, that they are reporting what is the truth. And that was the case in our study too. And we didn't ask the patients just one time about whether they were wearing the masks or not. We asked them every week. And in the reported compliance results, we used the worst reported outcome for the patient. That is, a patient could have been perfectly wearing the mask for the first 3 weeks, and then said, the last week I only wore the mask half and half or so. And that would be reported as he was not compliant. So I think we have done it as well as possible. But people are right. We didn't know, and we didn't go out and observe whether they used the masks or not. It's based on trust, like in most other trials.
The opposite point I've also seen being made today, which is that your cohort, because they were instructed to wear a mask as part of a special study, might actually have been wearing a mask better than ordinary people in a general population. I mean, do you think that's a possible effect?
Yes, it is. And that is a very important part of the conclusion as well, or should be an important part of the conclusion as well, because, we were delivering free of charge, high quality masks with a filtration rate of 98%. And we know that the participants were changing the masks. So they reported to wear 1.7 masks on average on weekdays and 1.3 per weekend days. And if I'm looking at what's going on now, then I see that many people use the same mask several times. It's in the back pocket, and you are using your fingers and putting it on. Yeah. Shouldn't be done that way. So exactly. That's a very important point. And if your mask has been on and you have used it, then if you believe in the mask, then you have to use or consider the mask as a dangerous thing if you touch it, because there could be virus on the outside, but there might also be virus on the inside, because you might be infected and I might be infected. We know that half of us who are actually contracting COVID-19 have no symptoms. And that is another part of what has been discussed now, because we saw a small effect, a small protective effect, but we have not discussed in our discussion here so far, what about source control? That is, if I have got COVID-19 and I wear a mask, to what extent might I then protect you from not being affected as well? And that study has not been carried out, because that would be unethical to do. That would, for example, be a matter of, taking patients who were just diagnosed having SARS-CoV-2 virus or coronavirus, and then randomize them to wear a mask or not wear a mask. And then the following days or weeks, you could go and look in their families and among their colleagues and in buses where they came and shops, how many got infected. And of course, that would be very unethical. You can't do the study. So what is the evidence then? The evidence is not strong, but it is indirect, and that is, there have been studies, for example, in laboratories where you have had infected people with a mask on, and then they have been talking loudly, or they have been coughing, and then you took off the mask and you could measure a lot of virus on the inside of the mask, and the virus sitting on the inside of the mask didn't go out and infect other people. So we all believe in that. So I think the message should be that wearing a mask in the correct way, of course, would to some extent, not a large extent, but to some extent protect you. But it's your contribution not to protect others, that we should take care of each other. And we, all of us, I guess, would hate the idea that I had a dangerous disease and now I passed it on to you because I was not wearing a mask. So we have good reasons to recommend masks, I guess.
So one thing I have not really understood is I appreciate the importance of proper scientific studies like yours, but surely we've got a huge amount of evidence from the past 8 months from different countries with different policies, and we see masks being mandated in the street in countries like France, whilst then we have countries like Sweden and until recently the Netherlands where masks are almost not seen at all. And yet they've all had this big second wave. So I guess, is it right to say that just from the kind of evidence we can all see, they're not going to hold back a big wave of infection purely by having a mask mandate?
This is a very, very important question you are addressing here. And, there have been reported in the literature several studies where they have said 1st of August, they had new legislation saying everyone should wear a mask. And then it was obvious that the days after, the infection rate declined. So we said, oh, that is proof that masks works. But it isn't, because when that kind of legislation is coming in effect, then it's because there have been a dramatic increase in that specific area or in that specific country, and you're not doing just one thing. You are putting on masks and you are doing other things, and you are really putting attention to COVID-19 in the population. So you are not only measuring on what on masks effect, but several effects at the same time. Exactly what we need. We need many strings to play on in order to get these achievements. And in Southern Europe now, last in Austria, we know that in Austria they were very fast asking for mask wearing when you are going to trains and buses and in shops. That started in the spring, and now it's under lockdown. We have been more relaxed, and we are not under a new lockdown. We use masks when we cannot keep the social distance, that is in buses and trains and shops and restaurants. So I think it's very difficult to learn a lot from these studies. It is so many things going on at one time that you can't differentiate the specific effect of the mask in these situations.
Would you like to see in countries like the Scandinavian countries that have been more liberal about mask usage, would you like to see more sort of mandates coming in? Do you think there should be stricter rules in places like Denmark, Sweden, Norway?
No, I think that we need to appeal to people, and I think that is the way to go. Mask policing in the streets would be a terrible thing, and that would turn things ups and down. So I think it is a tough topic to convince people they should go and use the mask. But I think we need to go and give the message wherever we can that you should wear a mask for yourself and you should wear a mask for those who are around you. I think most of us would really, really hate the idea that we are passing a dangerous disease, a potentially lethal disease, to those close to us.
Although, as you say, they don't appear to have held back the second wave in any country.
No, but you could say, how would these second waves have been without masks? They might have been worse. We don't know. But in many of the countries, they have used masks for a long time, and if the masks are sitting down under your chin or up in your forehead, and it's used several times before you change it, then you may have missed the opportunity to have the protection from the mask.
Let me ask you about a slightly different thing, Professor, which is that when did you do the study?
In April and May.
Right, so it was quite a while ago, and there's been sort of stories circulating that you have been trying to get this published in various medical journals and that they have said no. What's the truth of that?
That is correct. And I can say that we are very proud that we ended up in a really top-ranked journal, Annals of Internal Medicine, where we have had a very, very fruitful collaboration. They have suggested several additional analysis to really strengthen the message.
Which journals said no?
New England Journal of Medicine said no. JAMA said no, and Lancet said no.
And why do you think? What did they give reasons? Or why do you think they said no?
No, they didn't, and most often they don't. And that is not anything that's special. We are, most of us, dreaming high dreams about where to publish our fantastic results. And New England Journal of Medicine, that is the highest ranking, and I think they accept like a half or 1% of what they are seeing. And the major journals are most often interested in clear positive trials. That is, you have a hypothesis and you confirmed it. We had a hypothesis and we couldn't confirm it, so we had a neutral study. And generally, we are in generally the journals are not that interested in these studies. I know that it has been said that it has been a matter of politics. I don't see any evidence of that. I can't see it.
How has the reaction been? I've seen quite a few critical pieces about it. Do you feel that has been more than you would expect?
I think it has been well received, because I think that it has been we have been able to present the science of it and saying that these are the numbers. This is a study that's done as well as anyone could have done it. It's the world's largest. We really tried to figure out what the effect might be, and that has been acknowledged. I think that most people say that, this is tricky. Why should I wear the mask? And then we remind them about the matter of source control, and then people say, yeah, okay, that's fair enough. If it's a matter of not only protecting myself but also the others, we didn't think about that. Then let's go with it. So I think it has been well received, and it came out yesterday, and today I've had a very calm day. So I don't think anyone have. You know how the press is, I don't need to tell you, but they are looking for the angle or the conflict in this area. And I think we have been quite careful not overselling our message, but make it in context, make sense for people.
Very on message there. Thank you so much, Professor. Well, for those of people who might have thought the professor who had just published a study showing a statistically insignificant effect of wearing face masks was going to be someone who was hesitant about whether they should be worn, they would be disappointed, because the professor there was pretty enthusiastic, I would say, about masks, and was keen to make that clear. So thanks to him. Hopefully that cleared up some things, and thanks for watching. This was Lockdown TV.